Good morning, everybody. I'd like to welcome you back to the Prestige webinar series. So, a lot has happened since our webinar just a short 2 weeks ago. Between a new president being inaugurated, the flurry of changes made as a result of the new administration, which really isn't particularly uncommon, the vaccine efforts ramping up, talk of a new stimulus plan, yeah, there's certainly quite a bit going on. So what better way to say it than let's just get right into things. My name is Jason Flynn. I'm the Director of Human Resources and Client Services for PrestigePEO. And joining us this morning, we have a couple of familiar faces. Kathleen Sullivan is our Associate Director of Benefits, and she'll be joining me around the conversation that we have about the vaccines. And we're happy to also have back Ryan Yanalfo, the Director of Process Improvement for Prestige. Ryan leads our project management team and has some exciting news to discuss around the PrestigeGo mobile app that is currently available to Prestige clients and their employees. So, looking at today's agenda, as I mentioned earlier, we have a new president, in case anybody was unaware. And with a new president, new policies typically follow along. We'll be taking a look over what has transpired in the week since the new administration has taken over. And then we'll get into some of the workplace developments that we expect to see under the Biden administration and how this might affect small to medium-sized businesses. From there, we're going to review the current stimulus relief payments while discussing possible future plans around economic relief. Kathleen will then join me in providing an update around the COVID-19 vaccines and a couple of different ways we're going to tackle that one. And then Ryan's going to wrap things up on the webinar with an exciting look at the updated PrestigeGo mobile app that will provide clients and employees with an enhanced portal to view their information. So just as a quick reminder, and for those of you that have been on these webinars, I'm sure you could recite this by memory yourself, but all participants will be muted throughout the webinar. However, if you do have a question, please use the Q&A feature within the webinar itself and direct those questions to the panelists. Of course, we're going to do everything we can and are certainly our best to answer all the incoming questions from everybody today. Following the webinar, a recording of this webinar, as well as a copy of the presentation, will be available on the PrestigePEO website. Of course, this can be found under the Prestige Perspective and COVID-19 sections of the website. All right, so new president, new policies. Let's talk about what's been going on in the new administration over the course of the first 2 weeks. So as we discussed just a short minute ago, some pretty significant changes have transpired over the last couple weeks since our webinar on the 12th. The country has inaugurated a new president, and whenever a new president takes over, especially when there's a switch in party control, change comes soon after. And the first day of the Biden administration certainly was no exception, as they wasted no time in getting to work. So on January 20th, 2021, President Joseph Biden Jr. was inaugurated as the 46th president of the United States, and he quickly got to work. Over the first 2 days, in fact, over his first 2 days in office, the president issued 28 executive orders, presidential memoranda, agency directives, primarily focused on addressing the COVID-19 pandemic and, of course, undoing some of the actions put forth from the former administration. In fact, 9 of Biden's executive actions did directly reverse Trump's policies. And the executive actions really have only increased since the inauguration. And I don't think this is really a surprise to anybody, given what's been in the media and what's been discussed from the election moving up to this point. So I think that everything's kind of in line with what we've been thinking. Now, the main focus really needed to be on the pandemic response for COVID-19 as well as the economy. And really, I think the two almost go hand in hand at this point. This was a big topic of conversation during the campaign and the issues that now President Biden ran on. So it's no surprise that this is exactly where he's starting once he got into office. However, I don't want to slight the rest of the things that he has been working on. It is important to note that he's also touched on environmental issues, gender equity, immigration and ethics, this really all within his first week. Now, within the second week, we see that the focus of the administration will be really turning towards or adding to those areas such as immigration, again, healthcare, climate, and racial equality. The idea behind the president's policy declarations this week really is centered around strengthening requirements about buying American products and services, right? This is something that I think that really all administrations like to put forth. But beyond that, we are expecting to see some executive orders related to racial equality. I think we've seen those already this week. Of course, building on some of the immigration-related actions he took on his first day in office, executive orders to help combat climate change, as well as a focus on healthcare. So really that was a quick review of things that you may have already seen in the media and on the news or just out in print over the past couple of weeks, but I thought it was important to just touch on that before we get into, the workplace law developments that, we are anticipating, we are expecting to see, with this new Biden administration, right? I mean, certainly there are larger topics that the new administration is going to be tackling, and we just kind of went through those. The pandemic, the economy, immigration, these are, some of the larger things. However, there are a number of workplace law items that we know are near and dear to this administration. And over the next few slides, we're going to talk about some of the key areas that, we've researched, we expect the new administration to focus on, and how this could affect workplace law and all of our employees. So let's start off with workplace safety. This seems like a given, especially as it relates to the ongoing pandemic and how that's really been at the top of the president's agenda. So President Biden will most likely, from what we've seen, push OSHA for a mandatory emergency standard, which would require employers to develop and submit a workplace safety plan. It may even require government approval. So there's a couple things that go along with this that I wanted to just talk about. The first thing is that this could include a possible reinstatement of an Obama-era workplace safety reporting rule. This was slated to go into effect in 2017, but it was abandoned when Trump took office. So the thought is, if this is resurrected, the rule would force employers to report detailed injury and illness information to OSHA. Second, the experts that we've consulted with also do predict a steady increase in the amount of penalties issued by OSHA for safety-related infractions. Now, OSHA watchdogs have been particularly critical about the amount of penalties issued during the pandemic, noting that the agency hasn't really proposed a single penalty greater than $28,000 since the beginning of the pandemic. A Biden OSHA will lean more towards the maximum amount for COVID-related infractions with added penalties for willful violations. So, if we think about this before we move on, this is sort of the trend that, we've been seeing, that we've been looking at, right? There is definitely a push to a pro-employee environment to keep people safe and to keep people employed. And I think you're going to notice some of those trends as we go down the line here in these next couple slides. Wage and hour law is the next thing I wanted to tackle, and it's really another hot topic as we expect there to be a progressive agenda focused on the middle and working class issues. Now, I know everyone's probably heard a lot about the $15 minimum wage been floating around. We can expect there to be a push on that. There's going to be a push for the $15 minimum wage on a national level, which would be an increase from the current $7.25 minimum wage from the federal level as it stands right now. Now, listen, of course, there are states that are already working at higher levels of minimum wage, which is great. There shouldn't be much changes for them. But if this is something that is pushed through on the federal level, it would apply to all states. Employers should also prepare for, enhanced employer penalties and enforcement actions for noncompliance around wage and hour laws, right? Again, this is going back to workplace safety too. They're going to force employers to make sure they're following by the compliance and the rules and the regulations. And if they don't, the expectation is that they are going to see higher penalties, and the penalties will be enforced. Next on this slide is really an aggressive approach to stopping employees from intentionally misclassifying their employees as independent contractors. We actually touched on this in our last webinar in 2020, which was the idea of the belt tightening around the independent contractor misclassifications. We know that the President has indicated his support for putting together a national legal standard, but this is really going to, there's a lot of moving pieces here. It's going to need to involve multiple federal agencies working together with multiple state agencies, and of course the President's going to need congressional support if he's going to push this through into law. So it is an uphill climb. As I mentioned, there are a lot of working or moving pieces requiring different agencies to working together. But as we mentioned again on previous webinars, we do see a push for this in the future. And then last on this slide, we're also likely to see pay equity, legislation around pay equity passed at the federal level. The President supports passage of the Paycheck Fairness Act. And for those of you that are unaware, this act was a proposed labor law that addresses the gap in gender pay. This is something that, again, he supports, and he has vowed to sign it if it ever does come across his desk. Now, if the federal bill doesn't pass, there will be an increase in the number of states passing their own pay equity statutes. And this is only going to increase the compliance challenge for multi-state employers. And we've seen this around a lot of other different types of regulations and rules that kind of start a snowball effect. This one will definitely affect, if it doesn't pass at the federal level, it certainly will affect employers that have employees in multiple states. So moving on to the next slide here, there's 4 bullet points that I wanted to touch on with everybody, starting first with labor relations. This is another area where we are likely to see a return to the pro-labor agenda that was a hallmark of the National Labor Relations Board under the Obama administration. This right here could bring about a corresponding reversal of pro-employer initiatives implemented by the agency over the past 4 years. Now let's talk a little bit about employee benefits. This is another hot ticket considering the contrasting views between the current and the former administration. President Biden ran on the support of an expansion of the Affordable Care Act, and we know what the former administration felt about the Affordable Care Act. So the expectation now is that there will be a possible expansion of the ACA and also explore more opportunities for small businesses to help their workers save for retirement. This could include a retirement policy that looks to equalize the tax breaks of retirement savings for low and middle class income workers through tax credits, right? But I also think, moving back to the employee benefits side, on the health side, we've already seen the President take some actions with looking to open up marketplaces in support of people that need benefits during this pandemic. So this is likely to be a really, really hot ticket as we, go into the next 4 years. This brings us to employee leaves. And employee leaves is something that we've certainly talked about quite a bit over the past year, since we've really started these webinars back in April of last year. Of course, we've seen an expansion of leave options for employees during the pandemic with the FFCRA, and this is really likely to continue. As a longtime supporter of employee leaves, we may see greater support of family and medical leaves for employees as we get down the line. Last on this slide, we have employee privacy and data security. The next 4 years, I think, is really going to show a push for federal privacy legislation that favors consumer rights. This is something that we've seen quite a bit in California with the California CCPA, and that is the California Consumer Privacy Act that went into effect in 2020, which it's intended to enhance privacy rights and consumer protection for California residents. Listen, security is something that we take very seriously here. I know many organizations do. This, I think, regardless of any administration, this is something that's going to continue to grow more and more, if for no other reason than to protect our data, to protect our employees and our businesses. Now, I will say if nothing comes about on the federal level with respect to this, the states do have a number of CCPA-inspired bills that are pending, which if passed could potentially create a patchwork of conflicting obligations, again, for multi-state employers. So this is definitely something to keep an eye on, and we'll provide more information as time goes on. This moves us to the last slide in this section, which really starts tackling the idea of non-compete agreements or restricted covenants. Now, non-compete agreements, these agreements aren't currently governed by any type of national law. Now, there have been attempts to regulate these provisions on the federal level over the past few years, but nothing is set in stone. So the feeling is that the use of restricted covenants is an impediment to employee mobility, especially in the light of the pandemic and the massive unemployment rate. So there could be an attempt to regulate these provisions from the federal level. Of course, keeping in support of employees and workers, that's really where this is going. And as I mentioned earlier on, the trend is to support employees, support the working environment and their safety. This is just another area where at the federal level, they're looking to make things a bit more easier to keep people employed. Now, even if these measures are not taken at the federal level, employers can probably still expect movement on the state level for limited use. And we've seen this in such states as Maryland, Illinois, Massachusetts, and Oregon. So, like with employee benefits, global immigration is another area where there's a stark contrast between the former and the current administration. We do expect the Biden administration to push an immediate and dramatic reversal of immigration restrictions. So this could include a reversal of most, if not all, of the immigration policies from the previous administration, a comprehensive immigration reform, and also the creation of employment options for seasonal and high-skilled workers. Listen, this isn't something that's going to come easy for the new administration, and I think we've already seen where a judge temporarily blocked Biden's plans to halt deportations. So this is another area that's going to take some work as the president looks to put together comprehensive immigration reform, but it is something that we do expect him to push. Last, but certainly not least, we expect there to be some significant developments on the federal contract for federal contractors around affirmative action. You know, the most significant will likely be more reporting requirements, and we've seen this on a few bullet points over the last few slides, but there surely is going to be an emphasis on diversity, equity, and inclusion with these programs. So those are really the 11 bullet points that we've noticed of how the new administration, the new president, and their new policies, you know, could potentially affect the workplace law, affect employers, and obviously trickle down to employees. This is something that we're going to keep a close eye on, clearly for the next, obviously in the immediate future and for the next 4 years. And as new developments come on all of those bullet points, we'll certainly bring them out to everybody. So now I wanted to move on to the next session, which really reviews the individual stimulus relief payments available to people under the Consolidated Appropriations Act that was signed into law on December 27th. Now, if you recall, Seth and Malcolm, our friends over at the Groom Law Group, reviewed this provision during our last webinar. So I'm not going to take a lot of time discussing it, but I thought it would be a good idea to provide some context when we do talk about future plans around relief payments that are being discussed. Now, the individual relief payments under the CAA provides a $600 payment per individual taxpayer or $1,200 for taxpayers who are married or filing jointly. And there's also a $600 payment for each child dependent under the age of 17. And of course, these payments are subject to a phase-out depending on the adjusted gross income for individual or for joint filers. All right, so that's it. Like I said, I'm not going to go crazy with this. It's pretty simple and straightforward. These payments are already on their way out. A lot of people have already received them. So again, I wanted to just provide this as contrast for what I'm about to speak next. Now, there was a lot of back and forth around this last stimulus relief payment that I just discussed. And ultimately, ultimately it came to fruition under the previous administration, which is great for American people. You know, while it provided a much needed and long awaited help for the American people, there is a push from Democratic lawmakers to fulfill President Biden's desire to expand the child tax credit. And under this legislation, the IRS would be directed to send recurring monthly payments to American families. Now, under one draft of the plan that's being discussed, the IRS would be tasked with depositing checks worth $300 every month per child younger than 6, as well as $250 every month per child ages 6 to 17. This would amount to $3,600 over the course of the year for young children, as well as $3,000 a year for older children. Now, I want this to be clear. This is a draft that's being discussed, and I'm sure it's just one of multiple drafts that are being drawn up right now. So under no circumstance is this, quote unquote, on the table yet. But it does give you an idea, and the reason why I wanted to talk about this, it gives you an idea of the shift in the shift of thinking around providing economic relief for American families. Right? The stimulus payments, the economic relief that we've gotten under the previous administration, all right, it's great. It provided a much needed respite for struggling American families. But I think we all understand that, you know, a one-time payment for employees, for people that have been out of work, doesn't really move the needle all that much. So it's encouraging that there are different philosophies and thoughts around how to support American people, which honestly is going to support the economy. So getting back into the specifics of what we're learning about this specific draft, you know, unlike with the stimulus checks, the Democratic lawmakers are hoping to make these child benefits a permanent government program that would continue in future years, right? So multi-step we have going here. First is let's help American families around the pandemic. Second, let's continue to help American families that are struggling with the high costs of health care and child care and schooling and everything that we need to do to support these American families. Now, this proposal that we're talking about only calls for the expanded benefit to be enacted for 1 year, right, around the pandemic and what they're doing, after which the expectation is that they're going to the Democrats will put some political pressure to force Congress to extend them. You know, of course, like everything else, this benefit would be phased out for affluent Americans, though the precise income level really hasn't been determined yet. And really just to wrap up this section here, earlier this month, Biden did announce his intention to push for an expansion of the child tax credit as part of his $1.9 trillion economic relief package. And they have made significant progress on drafting that legislation. So we do know that this is close to the president right now. So again, this really just gives you an idea of the longer-term solutions that the new administration is looking to put in place right now. On one hand, it's great to see more effort in helping support American families. On the other hand, we also need to figure out how to pay for it, but that's why that is their job and not mine. So, but again, it's nice to see different thought philosophies around this process. All right, now we're going to move on to talk a little bit about testing. I wanted to switch gears and really bring up a topic that we haven't touched on yet in these webinars, right? And again, that's the topic of the COVID-19 vaccine. So it's a pleasure to have Kathleen Sullivan back, our Associate Director of Benefits. She's going to really help us break down some of the details around the vaccine coverage as it pertains to Oxford and to United Healthcare.
Thanks, Jason. Hi, this is Kathleen Sullivan, and I work in the benefits department here at Prestige. Today, I want to give you just a little bit of information on coverage for COVID vaccines and for testing. And I just want to give Jason a break so he can take a breath. so let's dive right into the vaccine coverage.
Thank you, Kathleen.
As Jason mentioned, we are talking about Oxford and United Healthcare today. So that's the coverage that we're talking about. Those are the health carriers. So we'll take it bullet by bullet. Oxford and United Healthcare will be providing coverage for COVID-19 vaccine at 100% with no member cost share. So that means if you have a high deductible plan, or you have a plan with a deductible just for RX, or you have payments on your plan or co-insurance, none of those are going to apply here. The vaccine is going to be covered at 100% no matter what kind of plan you have, okay? Second bullet, coverage will be provided both in and out of network basis, even if a member does not have out-of-network benefits. Now, that's unique. That's unusual for carriers to do that. And a lot of the plans that are offered here through Prestige are in-network only plans, EPO plans. So even if you have an EPO plan, you're going to be covered for that vaccine with non-participating providers. Just want to make sure everybody understands that. If you do receive that vaccine, third bullet point, out-of-network providers, you may need to pay for it out of pocket and submit a claim. Right now, that has not been the case. I know it's not been widely distributed yet, but there has been no charges for the vaccine so far. So far, the federal government has been covering it. So once the vaccines are more widely distributed, Oxford and UHC will be covering the vaccine through their pharmacy partners. So that's just a little glimpse into the future of what United Healthcare and Oxford expect. That last bullet point, they are going to expect to be able to have that distributed much like the flu vaccine is distributed on a monthly, on a yearly basis through the pharmacy partners. All right, so that's it for the vaccine information covered in full. That's the bottom line there. Okay, and I wanted to give I think this is a little less known. Everybody knows that the COVID testing is covered at urgent care centers and at doctor's offices, but United Healthcare and Oxford is also covering home testing for COVID-19. So I thought that might be information that would be valuable to our employee partners and employees. COVID-19 home testing covered by Oxford and UHC. They must be prescribed by a medical professional. So that is not necessarily a doctor. So that's also important. Medical professional could be someone at the lab. So prescription from the member's doctor is not usually necessary, as most labs will be doing screening and prescribe the test. Among the FDA authorized at-home COVID-19 tests that are available, the vendor LabCorp is the one that Oxford and United Healthcare is using. So you can research that Pixel by LabCorp. That's where you're going to go online, and you can order home tests through that, and then you're going to do that swab of just the lower part of your nose, which I don't want to get too detailed and gross here today, but it is simple, and they're going to send you the information and the kit, and then you're going to send it back to them. So I think that's a nice feature. All right, so we are going to talk about vaccines again, but this time I'm going to pass it back to Jason, and we're going to talk about vaccines in discussion more from the point of view of the employer's perspective. Right. Thank you very much.
Thank you, Kathleen. We've certainly fielded a lot of questions from employers around the coverage details that Kathleen just spoke about. And I felt, we all felt it was important for Kathleen to come on, pardon me, and really go through a lot of those details, and we appreciate her doing so. But as she mentioned, it's really also about the regulatory side and how it affects employers, right? So for the first large portion of this webinar, I really wore my regulatory hat and talking about workplace law. I'm going to switch gears and put on my HR hat now. And it's a very similar, but it's a much different hat to wear. And I want to go through what some of these things mean to employers as we get through, you know, the testing for the virus, taking a vaccine. Can I mandate a vaccine? What does it mean under the regulations that we have, and what should we be doing now? As I mentioned, we've gotten a lot of these questions, and it's important that we truly take a step back and think about it. This is your classic, you know, hurry up but slow down scenario. You know, hurry up, I want to get this vaccine out, I want things to go back to normal, I want everybody to be safe, but slow down, because you need to think about an awful lot of things before you're going to move forward with possibly mandating a vaccine or even being able to talk about and support employers around this vaccine. So what does it mean now that COVID vaccinations are here? Right? There's a lot of questions swirling around about safety, the workplace, employee mandates. What we do know now is that the Food and Drug Administration, the FDA, they granted the emergency use authorization for Pfizer's COVID-19 vaccine in the U.S. as of December 11th. Now, of course, with that, you know, came other pharmaceutical vaccine equivalents and alternatives that we've seen, you know, throughout the media right now and throughout the world that are really being, you know, put in place. The current hope right now is that the vaccinations will be available to the majority of people by April of this year. April's coming really quick, and that's really all I'll say about that. But I do think that we've seen a concerted effort to getting these vaccinations out to people quicker and more readily available. So while this is all welcome news, and this is something that we've been waiting for, it also brings to mind numerous questions and concerns for employees and employers. All right, so first we have here, what does the availability of a COVID-19 vaccine mean for employers? Now that the FDA has issued the emergency use of the vaccine, employers need to weigh the information that they have. They need to think about the pros and cons of whether they should strongly encourage the vaccination with their employees, or if they're going to require their employees to take the vaccine. And it's also important to keep in mind that the current situation is fluid. It is subject to change due to a variety of factors. This is HR. This is not uncommon. It is a bit gray right now. Sure, you can think, you know, you can require the vaccine. You know, I think that we've all seen enough to state that, you know, on a broad level, yes, you can require the vaccine. But the decision is not that simple, not in the least bit. So again, we need to take a step back. We need to think about everything that's involved. It's important to understand every factor involved before making this very new and this very important decision. First, there's going to be a lot of people that refuse to take the vaccine. You know, how are you prepared to handle those? Are you prepared for any legal action that may come your way if you terminate an employee for noncompliance? What about employees that have health conditions where they can't take the vaccine? Have you thought about disabilities or religious objections? What does your company policy state? You know, do you currently require employees to take the flu shot or other preventative health measures? I know I'm throwing a lot of questions at everybody right now, but these are the questions that you really need to be prepared to answer before you can make this decision, because they will all affect what happens afterwards. So the Employment Opportunity Commission, the EOC, has issued guidance stating that employers can require employees to get that vaccination as a condition of going to work. Employers do need to be prepared to exempt employees with disabilities and religious objections. And in those cases, an employer must offer a reasonable accommodation to the employee, such as working remotely, being reassigned, you know, really as long as the accommodation doesn't cause an undue hardship for the employer, right? So these are things that we've discussed. We've talked about reasonable accommodations throughout many a webinar, and how, entering into a good faith discussion with an employee is always preferable. So this doesn't change. These rules, these guidelines do remain the same. All right. So a couple of other points I wanted to bring up that you should really think about. If there is a high percentage of employees refusing the inoculation, if they are refusing to take the vaccine, this could cause a trickle-down effect. You may be jeopardizing your business due to losing a higher volume of employees because of this mandate. So, and we know the feelings on the vaccine, and people, forget whether they agree or disagree. Some are just nervous. There's a lot that we don't know. So forcing this could cause a trickle-down effect where you're now losing employees that you didn't think about or figure on. And as much as an employer should, or as much as possible, an employer should anticipate how a vaccine mandate would be received in the workplace, and consider how to respond if a large segment of the employees do push back. So communication is going to be paramount in this as well. Listen, there are a lot of very important topics with respect to this, and I understand that an employer wants to make, I understand if an employer wants to make the vaccine a requirement. It really does make all the sense in the world, but boy, there are a lot of factors to consider with this. And I can't say it enough, because I think it's important that everybody does take a step back, work with your HR business partner, work with Prestige to really formulate a process and a framework on what to do moving forward, so that it not only protects your employees, which is what we're looking for, but ultimately it protects you as an employer as well. We still need you too. So I'm going to move on to the next part here. Now, I know I gave Kathleen the hand wave and she almost moved the slide, so my fault. But the next side of the slide here, what are some of the considerations under these regulatory entities, right? This is the EEOC, the ADA, Title VII, and those are a couple of bullet points I want to get into now before I wrap things up and hand it off to Ryan. So the EEOC guidance regarding the vaccine states that the only situation where a vaccine may be mandated is when a worker poses a quote-unquote direct threat to themselves or others with their or by their physical presence in the workplace without being immunized. If an employee is capable of fully performing their current job duties remotely without spreading the virus to coworkers, then it does not appear you can require this vaccination. So something to think about. Remote work is something that we've talked about quite often as well, and I know a lot of organizations on this call right now are implying or have entered into those exact type of working arrangements. The EEOC also states that employers requiring the vaccine must consider reasonable accommodations for employees with disabilities. There it is again. Those are reasonable accommodations, disabilities. We need to think about employers. We need to put our best foot forward with employees as we go forward with making these decisions. If an employee cannot be vaccinated because of a disability, because of a health reason, then you as the employer truly need to determine whether you can provide a reasonable accommodation that would eliminate or reduce that safety risk for the employee. Next, if you do have a vaccine mandate, an employer can ask employees to show proof of vaccination. This is allowable. What is not allowable is that you cannot ask why they did not receive the vaccination, nor should an employer ask for, receive, or any additional medical information along with that said proof. This would violate the ADA, which prohibits discrimination. We really can't be digging into why they have or have not taken actions, because it could be asking them to divulge private medical information. So we need to be careful around that as well. Finally, some employees may believe that they have the right to refuse a vaccine, even if mandated by their employer. And they're absolutely right. They do have the right to refuse the vaccine. They also have the right to work somewhere else. If an employee who refuses, they can be fired. any employee can be fired, unless it fits with an ADA exemption in which, the employer can reasonably accommodate or the employee can provide proof of a religious exemption, something around that area, right? But listen, we're at-will employees, in a lot of cases. And an at-will employee can always pursue alternative employment if they don't want to get vaccinated as a condition of their current job. So it's important to understand that aspect as well. However, I do feel it's important to note that if you are working with union employees under a collective bargaining agreement, it is suggested that you consult with an attorney prior to implementing any mandatory vaccination plans around that. So good information to know. Last bullet point here, and real quickly as I wrap this up, what should everybody be doing now? Listen, follow the developments as they become known. Attend these webinars. This is a great source of information, as well as our website, as we try to put as much information out to the public as humanly possible. But more than anything else, remain flexible with your approach to whatever vaccination policy you are considering, right? The legal experts that we have consulted with really are on the side of strongly encouraging employees to take the vaccine instead of requiring to take the vaccine. There's definitely a fine line between the two, and I think you can still get the message across to employees without getting into a lot of the messy situation with the requirements around that area. So again, really, work with Prestige to put together a policy, a framework, and a communication plan to employees that are going to help everyone through this, and hopefully, we'll all come at this on the other side much better for it. So thanks, everybody, for listening through that part of the vaccines. At this point now, I'm going to hand things over to Ryan, who has some really exciting new developments on our PrestigeGo mobile app that we've rolled out to clients and employees. And before I say any more and steal any of his thunder, Ryan, the floor is yours.
Perfect. Good morning. Thank you, Jason. Thank you, Kathleen, and thank you all as well for your time and being here this morning. Again, my name is Ryan Yanalfo, Director of Process Improvement here for Prestige, and very excited to have the opportunity to come in and share a little bit of information with all of you about something we are very excited about, which is the newest version of our mobile app, as you can see up on the screen. And as you've maybe seen online in some of our communications and potentially some of our social media posts, we've been talking about this a lot over the last few weeks, and we'll continue to do so because we really want to raise awareness of this tool, right, that we have out there for both yourselves as managers, right, and our primary contacts, but as well as your employees themselves. Right. So this is a little bit of a sneak peek into what it looks like, a little bit of what it does, and really what's new about it. That's the piece that we are the most excited about, which is the new features that we're able to bring. So if Jason and Kathleen, you can pop over to the next slide here. I want to talk a little bit about how this product got to where it is now, and a little bit about why we're so excited about what it does today. We released the first version of our app back a year ago, right, in Q1 of 2020. It wasn't necessarily released to the fanfare that we might have originally hoped to because of the oncoming pandemic and other, sort of more important factors that Prestige was focused on at the time. But we were very proud to bring it to market. It's the 21st century, and we wanted an app, right? And we got to a point where we could release it. Now, our web portals, right, our Prestige Pro employee portal, those sites, they format just fine on your phone, but we didn't want to be routing people in that direction to say, yeah, just, boot up the web browser on your phone and type in a URL, and that's how you can get your info. We really, really wanted to be in the app space for obvious reasons. And one of the biggest priorities for us, moving on to the second bullet point here, we wanted to make it just abundantly, just overly easy for the employees of all of our client companies to be able to reach us very easily. As you all know, each company that we work with gets a dedicated support team of an HRBP, an HR business partner that is, a payroll specialist, and a benefit specialist. And as much as we always do our best to make sure all of our employees of our client companies know who that service team is, we felt that this could be a top priority for us in the app. Make sure that all of our worksite employees could have easy access to those three individuals, whether by phone or by email. So that was a trend that we started in the first version of the app that we are very much continuing into the second version, and we're very proud of that. The only drawback to version 1 was it was a little bit limited in its abilities, right? Very functional app that we released last year, and the idea was really just to get in the game, but it only really handled employee functions, right? Nothing from a managerial standpoint, first and foremost. And even within the employee functions, they were just really the basic ones. You know, you can download your paycheck, you can update your address, you can update your direct deposit. All really great tools to be able to do from your phone on the go in an app. But again, the functionality was fairly basic. So the idea was, let's get in the game and then let's really blow it up for version 2. Not only from a perspective of adding a lot more functionality, which I'll get to on the next slide, but also we took the opportunity to look at the app from top to bottom from a user interface and user experience standpoint. We wanted this thing to feel as streamlined as possible, keeping the top priority of easy access to your Prestige reps, but really starting to build out a sleek experience that could make performing these administrative functions that much easier, right? And again, open up the functionality included. So as we move to the next slide here, this is what I get really excited about, and I get to share with all of you a lot of what's new now. A lot of these are things we wanted to do from the beginning. A lot of these are things that came up as the year went on and as development progressed. Right from the beginning, we've added the biometric login experience to the app, not present in version 1, now is available in version 2. So depending on the model of phone that you have, if it has the capabilities for Face ID or Touch ID or any of those things, that is now included, and you can utilize that to log in to the Prestige Go mobile app. It also adds access to W-2s. It might seem like a fairly basic piece of functionality, but it was not present in version 1, and we're very happy to announce that it is in version 2. Obviously, W-2 season is upon us, and Prestige is in the process of finalizing and sending out all of our W-2 information. Now this is a very viable option for employees to get their W-2 right through the Prestige Go app. PTO requests is one of the more highly requested areas that, for one reason or another, did not make it into the final development of version 1, and we are very happy to announce is now a part of version 2. So if you are a company that tracks your PTO policies and balances in our Prestige Pro system, all of that information is now in version 2. We were showing employees their balances in version 1, but no one was able to submit requests or things like that. Now that option is there. An employee can submit a request to their manager for PTO time right through the app. Access to benefit enrollment is a very exciting one for us as well. If your company is going through open enrollment, or if a new hire is going through their new hire benefit enrollment experience, this is now additionally something they can do from the app. There's a link provided within the app that brings them into the benefit enrollment portal. Very similar experience to what it would look like on a desktop computer, but again, having the ability to do it through the mobile app when there is an active benefit enrollment period is something that we feel very excited about. The single sign-on to vendor providers is a very large indicator of our commitment to streamlining our technology, right? Making our ecosystem feel as sleek and streamlined as possible, right? So what this means is within the app, depending on your company and the potential products or prestiges that you utilize, you and your employees will see specific links in a helpful links section that pertains to your company. It's the links that your company should see based on the products you utilize. In all instances where we have successfully built single sign-on through our web portals, it's now available in the app. What this means is, let's say, taking Oxford and United Healthcare as a primary example, right? Or maybe MetLife. I'll use MetLife, our dental products, as maybe the example here. We've built single sign-on with MetLife so that if you're in our web portal, when you click on a MetLife link, you don't then have to now log in again to MetLife, right? It doesn't just bring you to MetLife's home screen and then you have to do another username and password scenario. We've built a single sign-on so that, once you've logged into our site, MetLife will know who you are when you click the MetLife link, and it brings you straight into the portal. We have turned this on within the app itself. So in all of the cases where we've previously announced we've built single sign-on functionality, the app now does that as well and will single sign on you into MetLife or some of the other vendor partners that we've announced this functionality for. We are continuing to build out SSO for more and more vendors as we move forward, and as we do so, we will be sure to announce them. And as we do, those links within the app will get updated themselves to function as SSO links as well. Push notifications is a sort of core function of a lot of apps these days that we're happy to announce is something we've introduced to this version of the app. As we move forward, we're going to identify key opportunities to leverage the notifications in a non-invasive way, but in an informative way that helps either you as managers or your worksite employees stay on top of either deadlines or reminders or payroll processing notifications. There's a myriad of ideas and opportunities here to leverage a notification system, and obviously something that is very front of mind for us is to use it in a way that is useful, but again, non-invasive. The last bullet point here is something, probably the number one thing that we're excited about, which is now we have introduced managerial level functions into the app. So if a worksite employee logs into the app and they're not also a manager or an admin of your company, they won't see any of these functions. They will only see the employee level functions, all of the address changes and download paychecks, all those menus. But if you log in and when we determine and we see from your login that you're also a manager, someone who's been granted higher level access to our systems to either run payroll or approve PTO requests for certain employees or whatever it is, you will see additional menus, right, that apply only to managers that give you the ability to perform some of those functions right from within the app, right from a unified, cohesive ecosystem, right? So being able to submit pay rate and position changes, being able to approve or deny the PTO requests that your employees have entered, terminating employees, and even approving your payroll, right? If we have payroll approval turned on for you and your company, you will have the ability to review your invoice and give an approval or a denial for your actual payroll right from your phone, right from your app. So as we move forward, we're going to continue building out and adding more and more functionality. This is a huge step forward for us. Jason and Kathleen, if you want to pop to the last slide here, just to give some additional screenshots of the way the app actually looks on your phone. These are the three primary sections of the app. They look similar, of course, but the menu options within them are different. Our whole HR center for HR functions, the payroll center for things like your W-2s and your paychecks and your direct deposit, and the benefit center for looking at your current benefits, potentially going into the enrollment portal if you have an active enrollment period, and reviewing other information like 401k and PTO information. Okay, so this app, again, is named Prestige Go. This is version 2. It is available now in the Apple App Store as well as the Google Android Play Store. For anyone who already had it downloaded on their phone, most people have their phone set to automatically download new versions of apps if they're on Wi-Fi or something like that. So for 99% of people who already had version 1, they will most likely see version 2 automatically updated to their phone. But certainly, we're very excited to announce this and highly encourage everybody to go ahead and download the newest version and use it to the fullest extent you can. The more empowerment that we provide you to be able to handle these HR functions on the go, the better. And we're very focused on making your lives even easier, right? So if anyone moving forward has any questions about this or any other technologies, my information is out there, and please feel free to give me a call directly to discuss. More than happy to get everybody's feedback and make sure we're building the proper ecosystem for you and your employees. That's it for me. Thank you again so much for the time. And Jason, back to you.
Thank you, Ryan. Yes, listen, and thanks for taking everybody through that. I can say I've been using the updated mobile app for some time now, and I mean, it's great. I know that Ryan and his team have put a lot of work into making this a better experience for worksite managers and employees, and I can certainly concur that, as I've been using it for quite some time. So thanks again for hopping on and talking with everybody around this new exciting feature that we've rolled out. And for everyone on the call, we really appreciate you spending some time of your morning here with us, going through regulatory updates, the new president and how it's going to affect the workplace, vaccines and things of that nature, as well as our mobile app. I will say, as we go down this line and we are venturing into this new world of workplace law and policies and vaccines and how to truly prepare for them in a way that makes sense, that's compliant, and that protects your employees, please utilize us here at Prestige. This is what we do. This is what we're here for. We're happy to, build these relationships with you, put the work into making sure that you are safe and compliant, and that your work experience for you as managers and employees is a good one. So beyond that, we are constantly keeping our website up to date. So if you visit the Prestige Perspective or the COVID-19 section, a lot of what we talk about here in these calls is on that website. In fact, a copy of the webinar is already posted on the website. So please stay tuned for future webinars as we continue to bring all of this updated information out to you. And aside from that, I hope everybody has a fantastic rest of the week, and I'll speak to you soon.